A massive brawl breaks out in a plaza parking lot not far from Sheridan College's Brampton campus. This is just one of several violent incidents captured on video in recent weeks in the city, causing fear among the community. I'm Christina Howard outside of 22 Division in Brampton, where videos like this are becoming increasingly common and sparking concern about city councillors and with residents. They've also captured the attention of Peel Police's chief of police, and she admitted today that violent crimes is on the rise in the area. And she said that part of that could be attributed to the end of the controversial practice of carding.
The street check issue had the conversation. I think what we're seeing is that I think criminals right now feel that officers aren't going to engage them. And right now, with the language of the regulation, I think it's restricting the officer's ability to engage with members of the community who are up to criminal activities. So criminals who are feeling empowered to carry firearms where they never did before.
You believe that more people are now carrying guns and knives than ever before?
Absolutely, I do. I believe that there are more. I think we're seeing it by the stats. It's not my opinion. I'm seeing it on the stats. I'm very stat-driven, and I say I'm seeing the statistics in Peel that we're seeing more stabbings and more shootings going on.
According to data from Peel Police, 426 rounds of bullets were fired last year after the ban on carding came into place. That's up sharply from 272 the year earlier when carding was still being practiced. Under the new guidelines, police are no longer able to cite race as the reason for collecting somebody's identification. Criminal defense attorney Howard Morton says correlation doesn't necessarily mean causation.
I'd like to see facts tying the two together by way of a fact check on the part of the chief. As far as we were concerned throughout the long history of carding, all carding ever accomplished, it was an intelligence-based operation, and all it ever accomplished, apart from harassing young people to the extent that there was complete distrust in communities with respect to the police, it provided some information such as are your parents separated or divorced, addresses, names of associates, and so on. So it was a pure intelligence gathering operation.
And while the city and region are developing a plan on how to better tackle this escalating violence, just this afternoon, another stabbing in Brampton, this time near Beauvert and McLaughlin, forcing 2 schools into lockdown. Now, coming up, some startling statistics about Peel Regional Police and how much time they spend dealing with mental health calls. I'm Christina Howard outside of 22 Division in Brampton, where Peel Police say they are stretched, spending more time than ever before on non-crime fighting activities. In a report released to Peel Council today, Chief Jennifer Evans revealed that her force spent nearly 33,000 hours dealing with mental health calls and suicide attempts last year. Statistics also show that Peel Police received 16 calls a day on average from individuals in mental health distress, and Evans says there's a ripple effect.
Huge impact on resources, and then the wait times. When the officers apprehend somebody who's suffering from mental health crisis, it's the wait times at the hospitals that are really having an impact. So, if you're going to a hospital for a medical emergency, I think it's concerning for people in the community to get to the hospital, the emergency departments, and see the lineup of cruisers and officers waiting. And they're really waiting to have the person who's been apprehended, who's suffering from, a threat to themselves or a threat to others in the community. And that's what's really impacting on police resources.
How do you combat that? How do you solve this?
Well, we have a COAST team. So in Peel, for the last over 10 years, we've had a community outreach and support. That's what COAST stands for. So we have an officer who rides along and with a mental health worker from the Canadian Mental Health Association. But it's really not addressing the number of calls we're dealing with. So there's different models right now. I understand Hamilton Police have got a great model with St. Joe's Hospital. So we're looking at other models and how we can try to divert people from going to the emergency department and get them into other social agencies that can deal with their mental health issues as opposed to apprehending them all the time.
Peel Police say they've witnessed a 37% increase in mental health calls over just the past 5 years.